Okay, so for MRI scan, to be specific, we'll look at its uses in orthopedics. So MRI scan is actually what modality for imaging and all of that. So does it have uses in orthopedics? Of course. So the most important part of this lecture is trying to see the different disease conditions that you can actually use MRI to be able to diagnose them. So MRI is magnetic resonance. Everybody should know that. So it's actually one of the most powerful diagnostic tools used in orthopedics, funny enough. So it provides good quality images of the bones, of the cartilages, of the ligaments, of the tendons, of the muscles, okay, and makes everything very nice for you to visualize. So the uses of MRI in orthopedics include the following. It can be used for soft tissue evaluation. So if I want to check any ligament in the body, okay, and most of the times all these x-rays, they show mostly bone pictures clearly. So pictures of all those ligaments, they hardly show it very well. So I might just want to go for MRI. Tendon tears, okay, can actually, evaluate tendon tears, muscle injuries, labral tears, in all those joints, shoulder joints, knee joints. Cartilage and joint assessment. It can also be used to access the meniscus to see if there's any tears or any issues in the meniscus. It can be used to evaluate articular cartilage degeneration. Also identify all those synovial, issues, okay? Synovitis, pigmented villonodular synovitis, and the rest of it. Alright. Use MRI, showing a very clean picture of the brain and also of the knee joints. So also bone pathology, okay, can be able to be used in, also diagnosing all those, fractures. So bone marrow edema. So there's accumulation of what? Fluid in the bone marrow. This could actually pick it up. Avascular necrosis, so it can be able to be used to identify when there's like the blood supply is cut off, Also used in diagnosing tumors, okay, confirming tumors. On the spine can be used to, checking out all those disc herniation, nerve root issues, spinal stenosis, degenerative changes, infections like discitis, osteomyelitis, Also metastatic disease. So any disease that is spreading from somewhere else to come to the spine, can be able to use this to confirm. Okay, so that's what we got.